And oh, good, you're awake. Well, let me just set this down and introduce myself properly. Hi, my name is Dr. V. Yes, I will be the one performing surgery on you later today. We do have in our system that you are in from triage and you'll be needing some surgery on your brain. Yes, well, don't worry, you are in exactly the right place. This is definitely the place you want to be if you're needing any sort of cranial surgeries, because we specialize in it, so you're in the right place. And it looks as though the procedure that you'll be getting is something that we do every day, 24 hours a day, so we do it all the time. And not to toot my own horn, but I am very good at it. Plus, the risks are very low. This is not a high-risk procedure, so you've really got nothing to worry about there. Great. Well, it looks like we've got some things in our paperwork to go over. So, first and foremost, could you just confirm your name for me? And because you were a little out of it earlier, they weren't sure just exactly how you spell it. Got it. Perfect. Thank you. And please confirm your date of birth. Okay. And I do have the notes that triage took from me, but in your own words, could you just explain a little bit about what happened? Okay. Yeah, so it got kind of hard to grab hold of things. Been feeling a little bit weak. Has there been any fatigue? Okay. And brain fog? Yeah, that's always a little bit concerning when you're just going about your day and all of a sudden you forget where you are. Yeah, that can be distressing. I totally understand. Okay. And have you been to the doctor within the last 6 months? Okay. And it looks like the last time you got some blood panels done was last year. We might take a couple more just for a record, but there's nothing with your history that would make me think that I'd need to take something else for this surgery. We will have to run a couple of tests. I'm going to take a pre-op test so that after we're done with our operation, we can have a baseline to compare and see how you've improved after the procedure. So a lot of it will be checking your vascular movements, since that is the main reason for the concern. But there might be a couple of cognitive tests that we perform as well. Okay, and has anything like this happened before? Right, we do have here in your records. Okay. Alright, and are you on any sort of medications? Anything at all? Okay. Yeah, that won't have any interactions at all with any of the anesthetics, so we should be good there. Okay, and any sort of mental health changes within the past year? Mm-hmm. Okay, and any history of that within the family? Okay, and we got a pretty good family history earlier, but let's just see. Oops. Any vascular issues that you're having in the family? Anything known to be genetic, hereditary? Mm-hmm. Okay. Great. Well, your cognitive abilities don't necessarily seem to be affected by this issue, but again, we will be adding those tests just in case, just a couple of them. But just a couple of standard questions to start off here. Could you please tell me the color of the grass outside? Good, green. And the color of the sky? Good, blue. Could you please tell me what year it is? Good. And could you tell me when your half birthday is? Yep. Good job. And what's your favorite color right now? Good. Okay, and could you tell me the color of your eyes? And do you have any siblings? If you do, what are their names? Good. And your age, please. Good job. Okay. All of that is looking good. Let me just take a brief look before we do anything else. That. Perfect. Alright. So I'm going to put on my gloves and we're going to start checking out your reflexes and making sure that your muscles are moving in the way that we would expect them to. I know that that's been a bit of an issue, so if we do run into a problem, don't worry at all, as we know what's already been happening, so I know what to expect. Okay, so first I'm just going to touch the muscles around your face. Okay, so just stay still. Good. Okay. Good. So we're going to start with your face muscles, since that is where you are experiencing a bit of the issue, okay? So first, I'm just going to ask you to try and raise your eyebrows, okay? Go ahead and raise your eyebrows. I'm just going to feel the muscles moving. Good. Okay. Now, go ahead and furrow your eyebrows, okay? Furrow your eyebrows like you're concerned. Good. 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 Okay. So far, so good. Alright, now I'm going to ask you as best as you can to wiggle your nose, okay? Go ahead and wiggle your nose. I know this is silly. Good job. Okay? Now this time I want you to puff out your cheeks. Okay? Puff them out. Good. Good. Okay, now can you just suck them in? Suck in your cheeks. Okay. Okay. Now your eyes, I'm going to ask you to try and close this eye. Try and close it, and I'm going to try to stop you. Okay? Go ahead. Good. Okay, that seems to be a little difficult for you. And again, go ahead and try and close this eye. Okay, thank you. Okay, so now I'm going to ask you to this is going to seem a little strange, but I'm going to hold your jaw with one hand. I'm going to ask you to bite down on my finger. Just bite down. Okay, thank you. And now I'd like for you to try and smile just with one side of your face. Go ahead and smile on this side. Okay, and now the other side. Just one side at a time. Good. Can you please try and wink one eye? Wink one eye. Okay. And try and wink the other. Wink. Okay. I seem to be having some trouble moving your eyes a little bit. So I am just going to look into them just a minute. Make sure my light is working here. We might have to use a slightly brighter light. Oh, there we go. Okay. So I'm just going to take this light here. Would you mind just looking directly behind me with this eye over here? Go ahead and look behind me. I'm just going to look into your eye here. Just looking into your eye. Okay, now could you please look up? Look up, please. Okay, and look down. Good. Now look to the left. Okay, and look to the right. Oops. For the sake of time, I'll just move to this light here. It'll be a bit brighter, okay? So, could you please look to the right? Good. Okay. Okay. Good. Now, could you please look up and then to the left? Okay. And down and to the right. Okay. Now this eye. Once again, just look behind me for just a moment. Alright, now go ahead and look up. Look up. Good. And look down. Look down. Okay. Good. And look to the left. And to the right. Okay. Good job. Now look up and to the right. And down and to the left. Okay. I am getting a little bit of wavering from your eyes, which isn't necessarily a big issue, but could you please just look at my nose? Just going to see if I have any pupil dilation issues. Good. Okay. And could you please follow the light? Just checking for wavering, any sort of other movement issues. Okay. Good. Thank you. So, I've done your face. Now go ahead and turn your head to this direction. Just turn, turn, turn. Good. And go ahead and turn your head in this direction. Good. Okay, we'll just station you back in the middle there. Now, could you go ahead and lift up your shoulders just a little bit? Just lift your shoulders. I'm just going to feel your muscles, okay? Just going to feel your muscles as you lift your shoulders. Okay. Good. Good. Keep lifting. Good. And could you just put them down? Good. Good. Now I'm going to check your reflex with your eyes before I move too far down here. So could you please just look straight forward at me, okay? Good. Keep looking straight forward. Good. Okay. Interesting. Good job. Okay. Good. Good. Just checking to make sure we're blinking when we should be. Good. Okay. Now go ahead and stay still for me, and I just want you to hold your hands out in front of you with your palms facing up. Just going to gently squeeze down your left arm here, and I'm going to squeeze a little bit at your wrist. I'm going to look for that fingers curling reflex. Good. Okay. Now, could you please squeeze my hand as hard as you can? I promise I can take it, okay? So just squeeze my hand as hard as you can. Ready? Okay. 1, 2, 3. Okay. 3, 2, 1. Good job. Okay. Now I'm going to feel down your right arm. Okay. And looking for that fingers curling in reflex, squeezing just a little bit on your wrist here. Good. And I'm going to have you squeeze my hand again as hard as you can with your right hand, okay? Ready? 1, 2, 3, squeeze. Good. 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 And 3, 2, 1, relax. Good job. Okay, I'm gonna check your knees, making sure that they have the kick reflex. Okay, ready? 1, 2, 3. Good. One more time. 1, 2, 3. Good job. I know it always feels a little tingly, so good job there. And you're right. Here we go. 1, 2, 3. Good. And again. 1, 2, 3. Good job. Okay, that one's a little bit weaker, but that is what we were expecting given what we did in triage. Okay, and now could you just wiggle your toes down here for me? Wiggle your toes. Good. And again, wiggle your toes. Wiggle your toes. Okay, very good. Everything is looking about as we expected it to. So now we're just going to move into a couple of cognitive tests just to make sure that we're not missing any functions that you're lacking with what we've got already, okay? Good. Alright, so could you please read to me this number here? Good. And this one? 4. Good. And this one? Good. And this one? Okay. And could you please read to me what direction the legs of the sea are facing? Okay. And this one? Good. And this one? Good. And could you read to me these numbers from left to right? Okay. Good job. 6, 3, 8. Now, are you able to see these at all? Okay. go ahead and tell me what direction the legs are facing in the middle here. Okay, and here. Okay, and here. Good. And can you read these numbers? Go ahead and give it a try from left to right. Okay. 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 Good. 5. Very good. And can you read these symbols here? O, X, O. Very good. Okay. Now I have just a couple pictures to show you. So we're going to start off simple. Just telling me what they are, okay? Could you tell me what this image is? What is this image? Good. This is matches. And what about this one? This one. Fish. Good. This one. Good. That is a radio or a boombox. And could you tell me what this is here? A fishing rod. Very good. Okay, and here? Good. A thermos or a cup. Okay. Very good. Now, could you please tell me at least 2 items that have the color green in them? Good. Okay. You could say the palm tree, the bug, the sleeping bag, or the frog. Very good. Alright, and could you please tell me what side of the card the palm tree is on? Top, bottom, left, or right? Good. And could you tell me what side or part of the card the boot is on? Okay, very good. And could you tell me what the difference is in color between the boot and the sleeping bag? Good job. And lastly here, is there a fish on this card? Is there a fish on this card? Correct, there is not. Could you tell me which side of the card the owl is on? Good. Are there more than one object on this card that have the color red in it? Good. There are 3. There is this cup, the bike, and the radio all have a good amount of red in them. Could you tell me where on the card the map is? Where on the card is the map? Good. Good job. Okay. We have not discovered anything new as to what your issues are, but we do have a pretty good idea of the things that will need to be improved by this surgery. So the nurse will be in a little bit to pre-op and get you ready for surgery, and then you'll be seeing my face again, as this will be the surgery that you will need to be awake for. So we will get you in good hands and get everything going for you, and it will be done before you know it, okay? Good. Do you have any other questions before I leave and the nurse comes in? Great. Perfect. Well, you get some rest, and we'll get you ready to go, and we'll get you all fixed up, okay? Great. It was so nice to meet you, and I'll be seeing you soon. Bye-bye. I'd like to thank my lovely Moth Gang patrons, Abby, Alex, Alfredo, Callum, Christian, David, Glenn, Hair Apparent, Joey, Jonathan, Mikey, and Omega Lol for their support. And if you'd like to learn more about what it means to be in the Moth Gang or about my Patreon, there's always a link in my bio.